Often, steroids may not be enough to control their disease. And there are a lot of side effects that go along with steroids that we talked about in the last talk. And so, a lot of panting, drinking, urinating a lot. They can have accidents in the house. They'll eat you out of house and home. They can get a pot belly. It can increase some risk of some vascular issues, increased blood pressure. So, we don't want to have dogs on high doses of steroids longer than we have to. So, one of the things that we'll often use is another immunosuppressive drug. And again, we're doing that kind of for a few different reasons. One is to try to spare the dose of steroids we need, glucocorticoids that we need, to reduce some of those side effects, but also kind of ramp up our suppression of the patient's immune system. So these are the four that, I would say 90% of the time, this is kind of the toolbox we're thinking of. There are a few immunosuppressives that, I've maybe once used in a dog with IMHA that wasn't responding, and some I have not used, but they're just kind of reported. So I wanted to include them. So we're going to go through these one by one. And I do have an overview slide at the end of kind of how I think about implementing which drug and how I think about including steroids in that. But we're going to go through each drug and go through side effects and things like that. But right now, I would say most of my patients, I'm going to go and start them on this pretty soon. So even though it's not considered necessarily the standard of care treatment for IMHA, here at Cornell, we're big on adding these in sooner rather than later.